Hi, my name is Andrea Capere, and you're watching Mission Nonprofit. Each month we connect with local organizations and agencies that are making a positive impact in our communities. March is Gambling Awareness Month, and we've invited Maureen Greeley, Executive Director of the Evergreen Council on Problem Gambling, and Certified Gaming Counselor Tana Russell from Providence St. Peter Hospital to discuss this topic. Thank you for joining us.
Thank you for having us.
So tell us about the council. What's the mission? How did it get started?
The Evergreen Council on Problem Gambling has been around for more than 25 years. It was founded in 1991, and that was a period of time when there was a lot of looking at how gambling was affecting people as a public health issue nationwide. And so our council was one of a number of affiliates of the National Council on Problem Gambling, which is based in Washington, D.C., and we are the Northwest chapter, the Washington State chapter of that organization. We are first and foremost not anti-gambling, and we want to make sure everybody understands that. Most people can enjoy gambling for fun and recreation. That's the whole point. But there are some people who will have problems with gambling, and it can affect their lives in very devastating ways. So our mission is to make sure that we advocate and provide programs and services for the continuum of care, from prevention to treatment to recovery, so that anyone who needs services in Washington State can get them.
And let's talk about resources for help. We've got Tana here who works at the hospital. Can you tell me a little bit about your role and how you relate to the council?
Yeah, we have a gambling treatment program at the Chemical Dependency Center, and it's off College Street in Lacey. And we do gambling assessments. Like she said, many people do not develop a problem with gambling, but for those who do, it can take complete control of their lives, and they need some help to come out of that and put their lives back in place. So that's why we're here. We'll do assessments to determine, do they have a gambling disorder? What's an appropriate level of treatment that could help them with that? We'll do treatment planning with them, which is where they're identifying, why are they here? What are the problems that have happened? What's the life that they want? And what is it going to take to get there? And we help them with that process. We do group therapies and we do individual counseling, and we try to get the family involved as much as possible if we can, because they're only with us a few hours a week at most. Most of the legwork happens at home, and the more support they can have at home, the better.
Everyone's got to be on board for that recovery.
Yes,
Yeah.
yes. And we encourage them to engage in other resources as well, be it mental health counseling, medication management, Gamblers Anonymous meetings. The more resources, the more support they've got, it's like a bigger cushion in their life for them to be able to get over the hump, to be gambling free, and to start to regain that control and be able to live their life how they really want to live it.
So that sounds like a really powerful partnership between the council and the hospital. Can you talk about other partnerships
Absolutely.
you have?
Tana represents there are about 33 certified problem gambling counselors in the state of Washington, and they may be with agencies, they may be individual private practice treatment providers, and those folks have made a commitment. They either have a chemical dependency or a mental health, behavioral health background. They've made a commitment to learn enough about problem gambling or gambling disorder that they can help people. So that's one area. Treatment is a very important area, and in Washington, there is free treatment for Washington residents thanks to the state problem gambling program, which is a part of the Healthcare Authority. So we partner with the Healthcare Authority and other state agencies, the Washington State Lottery, the Gambling Commission. We are fortunate to live in a state where our gaming industry is very invested and engaged in responsible gaming, and that makes a big difference to what we do. We work with the recovery community, recovery cafes, and recovery organizations, because that support, as you mentioned, is crucial for people to stay healthy and find quality of life that they want to return to. So we really work with everything from nonprofit organizations to state agencies to individuals to all sorts of groups, and we're very fortunate to have great partnerships in Washington.
So a lot of us think about recovery in other ways, substance abuse, for instance. So I imagine gambling is a little less obvious to determine when it is a problem. So what do we need to know about problem gambling?
I think there are a number of things. You're right. Gambling disorder or problem gambling is a hidden addiction, and it is an addiction. It is a public health issue, and I think that's the first thing that most people don't understand. When we do outreach and awareness, it's that very basic. This can be a problem that can affect you or someone you love in a devastating way. If you need help, there is help. It is similar to other addictions, but it's really important for people to understand too that there are some important differences. One of the biggest being the financial situation and the difficulties that people and families might find themselves in because of a gambling addiction. So just like there is type 1 diabetes, type 2 diabetes, not every addiction is exactly the same. There are fundamental things, and I'll let Tana talk about that you would do in treatment, but there are some really important differences that our treatment providers learn to deal with as well.
Yeah, it really is kind of a hidden addiction, and there's a lot, we've been living with decades of messages of it's just, it's fun and glamorous, and there's something wrong with you if you have a problem. And that's just not true. There's nothing wrong. Our brains are doing what they're designed to be doing. It's just been directed in a way that's wreaking havoc. We can redirect that into healthy ways. All of that resourcefulness and energy, when directed into healthy behaviors and healthy means, really ends up creating people in our society that are some of the strongest, healthiest, most contributing members in our society because of that transformation process that they've gone through. But again, because of the messages of why can't you just stop, by the time they realize they can't, it has gone so far.
Yeah.
There's just been so much damage, huge debts and relationship problems. And when they walk in the door, unfortunately, I'd love to go out and pull people off the street, but they're the ones who have to have the courage to walk through the door and pick up the phone call. And so many people have said, I've driven by your office 20 times before I ever pulled in. Or I came in the parking lot and I sat in my car. Or I came in the lobby and I turned around and went out. Because everything in them says, you can do this on your own. You don't need help. And if you just gamble one more time, it'll solve it. And that's really not the case. When they finally get that courage and they ask for help, and I'm able to tell them, there's nothing wrong with you. Recovery is possible. It's possible for you, and you don't have to do it alone. You literally see like a weight just kind of come off their shoulders, where finally it's like, oh, thank heavens, there's a way to come out of this, and they can start turning it around.
And even driving into the parking lot that first time, that's an act of bravery too.
Absolutely. We call it the 600-pound phone call. The phone's very light when you're playing an app on your phone, but the moment you want to pick it up to ask for help, all of a sudden, it's so hard. It's so hard to do. So just that act takes a lot, even just telling a family member. And some will bring a family member to the facility with them as moral support, make sure I don't walk out the door.
Yeah.
Keep me there because I need this.
Yeah.
What are those indicators? Is it beyond those tangible things of I've missed another mortgage payment or my relationships are suffering? What is going on that makes it this health?
Well, one thing that is unique about it is the suicide rates are astronomical. We do consider this to be a disease that, if it progresses, can be fatal because they die at their own hand. It can get, if I drink, someone else doesn't get drunk, but I can gamble my spouse's property, our mortgage, my children's college fund. I can really wreak a lot of havoc in other people's lives as well as my own. And so that's just a very hard burden to carry. And so that translates a lot into missed work, financial problems, not being able to be productive as work because collectors are calling all the time, health-related issues, many of which come with the stress. As we know, extended stress over long periods of time can cause heart problems and strokes and obesity and ulcers and all these kinds of health problems, which can stem back to things from their gambling behaviors.
So those
It
kinds
ripples.
those kinds of health issues are really important to go beyond the 33 treatment providers that we have right now. We're trying to work with primary care physicians, nurses, emergency rooms, people who are already treating people with drug and alcohol addictions as well, because the norm is that co-occurring disorders are going to happen together. So problem gambling, you could just have a gambling disorder, but more likely you're also going to have a problem with something else, whether it's anxiety or drugs or alcohol. Particularly with youth, that is a big norm. So trying to get people, and that's a lot of what March Problem Gambling Awareness Month is about, trying to get people to start doing screenings and ask questions that just start to bring that next step in. If you're seeing someone who's having problems with alcohol or drugs, ask some questions about, well, where did you have your last drink? Why did you get angry? What was happening? And they may tell you that it's related to gambling as well.
So there's lots of resources for each individual group, individuals, families, youth, and seniors. Can we talk a little bit about some of that?
Absolutely. Senior populations are particularly important because when you're talking about a disorder that you could lose hundreds of thousands of dollars very quickly, you are talking about a population that if they are retired, and many of them are, they could lose their savings that they may not be able to easily recoup. I would say that we hear from adult children of retired folks probably more than anyone else about what can you do for my mom, what can you do for my grandmother, because they are on limited incomes, and that becomes a really fragile place for them to be if they are losing that. So this Problem Gambling Awareness Month, we're focusing a lot on senior populations, and back to what Tana was saying, focusing on what are those wonderful quality of life issues that we have in Thurston County, that we have in Washington State. We have the mountains, we have the water, we have biking and hiking trails, and so many great things to offer people that can gain their life back and enjoy life with family and friends. One of the wonderful things we've been able to do is partner with places like Thurston Community Media on informational and public awareness campaigns, public service announcements. So we're thrilled to have that kind of partnership.
Yeah, well, thank you. We offer a nonprofit organizational membership that allows those nonprofit partners to come in and get a professional PSA created for nonprofits only. So we do have that PSA completed. So let's take a look.
Gambling used to control my mom's life. It started out small, with regular trips to the casino with friends. But after a while, her friends stopped going. She stayed. She told me that she just wanted to play her game and be left alone. Mom missed out on a lot while she was at the casino. She even missed celebrating the holidays with family. It wasn't until my daughter called her in tears, asking if she loved the casino more than her, that Mom realized it was time for a change. So she called the Evergreen Council on Problem Gambling's 24/7 helpline at 1-800-547-6133. They were able to help her find the resources she needed to begin her recovery journey, and were there when she just needed to talk to someone. So, if you or a loved one has a problem with gambling, there's help. Call or text the Evergreen Council on Problem Gambling's 24/7 helpline at 1-800-547-6133 or visit their website at evergreencpg.org. Remember, hope starts here.
So that was a really touching but hard subject to deal with.
Gambling addiction is a hard subject, and it's particularly hard if you're in the throes of it, because as Tana mentioned, the amount of stigma and shame that comes with this particular addiction, many people don't see it as a health issue, they see it as a moral issue. And we often hear the question, why don't they just get up and walk away? And that's not possible. For someone who has an addiction, you're asking them to change their brain, to change their lifestyle, to change their habits, to change their impulses. That takes time and it takes a lot of support. And it takes a lot of support in different ways. One of the things that we're working hard on with our treatment community is how do we help people with different cultural backgrounds, with different religious backgrounds, different ages, different gender issues. So it's not just a one-size-fits-all. We try to do a holistic health program, and we try to make it fit where the person is on that continuum of care. Are they in the early stages? Are they in very deep debt? What do we need to help them with? So seniors are an important population, but there are a number of other important populations, one of which is youth. The big thing that's really affecting our youth populations now is this gaming and gambling are blurring lines. If you have a laptop, if you have a cell phone, you can get on and play games, video games all the time. That can be addictive as well. Internet addiction for youth is one of the major issues that we are seeing right now. And you're talking about a young population that's already risk takers. They're at that stage of life where taking risks is natural. For some of them, they'll grow out of that. But the earlier you start to gamble and game, the more likely you are to have problems in the future. And I think we see that. We need more programs for youth. And I would let Tana talk a little bit about that if you have any programs
About
for
more youth programs? You want to combine and group people in the same phase of life. So I wouldn't put a youth and an adult gambling group, but we would do individual sessions with them and bring in their family as well if we can, and kind of get everybody on the same page, give them a good support system around them so they can make positive changes as well. In our youth program, I went in and gave some education about gambling and asked them about it, and they all said no, and then asked, well, have you ever bet money while playing this game? Oh yeah. Have you ever bet money while playing this game? Oh yeah. And then all of a sudden they start piping up, oh yeah, this game and that game, and you were playing that the other day, and it's all games in which they were betting either expendable money if they're old enough to have a job, or their cigarettes, or their jewels, or their phones, or their video games, or whatever it is.
Or if you have a device that your
Any kind of
parents might be
device.
That's right.
using, you're accessing their
right.
credit card.
Yep.
Yeah, it's hard. And when you're talking about this holistic person, and you're talking about addiction and how this is so challenging to treat, you're touching on this idea of changing their entire lives. Their social networks are built around these things.
Absolutely.
So how are you responding to that? You're moving them from this setting that is comfortable and normalized for them.
Right. It's not easy with youth, and so one of the things we try to do is get out in front of the issue. Prevention is, if we can do prevention before we do treatment, we might be able to help a lot of people make healthy choices before they ever get to that point. So with youth, we have a number of youth prevention programs, including our New Directions peer-to-peer program, which is a program that is probably our most popular program among youth. We had more than 300 students participate this last semester in their high schools, and they actually create media campaigns by youth for youth. So they're talking their own language, and they're hearing from one another, because the last person they want to hear from is somebody who's 20 years older than they are. They want to hear from somebody who's just like them. So the students get together and they create radio campaigns and television campaigns and social media campaigns. Social media, of course, with this group is incredibly important, because that's how they communicate. And they get an opportunity to do their skills. They walk away, if you're a high school senior and you walk away with a media campaign that you can take with you to college, or you can take with you to a job, and you actually have a radio ad that has, or a PSA that has aired on the radio, that's a pretty exciting thing for a high school student.
Yeah, turning lemons into lemonade. And preaching to the choir here about workforce development.
Yep.
So you've got some fantastic numbers and proof that these programs work. And I want to talk about, what are some successes that you've experienced through these programs?
I'll let you start.
Well, I have people all the time who said, oh, well, I heard from you because of a Google search, and I found ECPG, and they referred me to you. And actually just recently I had a chance to call a bunch of previous patients for a follow-up thing I was doing. And it was wonderful to get to hear from them. Many of them still doing well, now gambling free between 1 to 3 years. And that's just kind of neat. Unfortunately, the nature of our work is often we don't know how people have done until they come back for more treatment. If their treatment was successful and they did what they came to achieve, they go on with their lives, and more often than not, we never hear from them.
No news is good news.
Right, no news is good news. But sometimes I'm the outreach and education person, so because I'm out in the community a lot, sometimes I do just happen to run into people who have been previous clients, and they talk about, you know, how they're still doing strong and they've learned a lot. And unfortunately, I mean, there's always things, we're human, so we're always constantly growing. And so they for a long time are continuing to invest in relationships and their overall financial plans for their lives and that kind of thing. But they have the tools to do it now. So yeah, it's pretty neat.
Not everybody gets to go to work and one day out of every 30 get a call or an email from somebody that says, I'm here today because you helped me. That, I think, is the most fulfilling thing about the work we do, is you might not think about it 24 hours a day or even 8 hours a day at work, but somebody comes and reminds you that their life was changed for the better and possibly in a very significant way. And that's a really good feeling to take that away. So it doesn't mean we don't have lots of challenges, we do, but when we have treatment providers who are passionate, I think that passion goes a long way. We're also known for our training. The Evergreen Council puts on training conferences and workshops for counselors to become certified. So there's that element of it, but it's also for students. It's also for prevention specialists. It's also for members of the gaming industry to come and learn more about how they can make changes, how they can harness that energy of technology that might be part of the problem, but it can also be part of the helping solution. How do we turn that technology into tools for people to use to limit themselves when they need to get reminders that you haven't taken a break for a while, to help in quality of care and to help keep gaming fun and safe and an enjoyable recreational element for those who can enjoy it.
What's available to us in Thurston County?
Did you want to start? You've got a lot going on. They stay very busy in March. We have on March 7th, we have an open community talk where everyone from the community is invited to come to our facility, and in honor of Problem Gambling Awareness Month, the talk in March is on gambling, gaming, and apps. And actually Liz Glavish with ECPG is going to be a guest speaker for us, and I'll be speaking, and we'll be talking about what she mentioned earlier, the merging worlds of gambling and gaming and apps. And Liz, specializes with the youth, and so she can speak up on that. And I'll be talking about gambling disorders and what are the signs that this is starting to become a problem, where it's moving from recreation to an issue that they're having trouble escaping from. What goes on in treatment. We really just want to take the veil off of treatment. It's nothing mysterious, okay? And just tell people this is exactly what we do. This is what you can expect. There is hope for change, and whether it's for them or a loved one or family member or child, whatever, here's how to access the resources. You can't make someone want help, but you can do everything in your power to make the help very easy to access, so that when they're ready, they know exactly where to go, and they have their fears eased a little bit about what to experience and things. So that's one thing we're doing. And then March 12th is National Problem Gambling Screening Day. So we're promoting that, but you could probably talk better on that.
That is a day when we are asking treatment providers, not just the ones that we already have in our programs, but again, reaching out to hospitals, reaching out to alcohol and drug counselors to say, please do a simple screen with the folks that come in. Make it free that day, let them come in, let them find out it's completely confidential. The person can choose to get referral to treatment, or they can choose to just take that information away with them. And when they are ready to do something about it. So we have a number of community events. That's one in Thurston County. We have tribal events in Thurston County that are going to happen, community dinners, community events. Several of the state agencies are doing employee programs to bring awareness to this issue among employers and employees. The lottery always gets involved, and you'll see throughout March messages on the screens where you go to play lottery games. We'll have a March Problem Gambling Awareness Month message. So we have a calendar on our website. People can go on, check it out, and see what's available close to them, whether you're in Thurston County or elsewhere.
How can we stay up to date on your work?
Again, I think the first place to go is to our website,
Okay.
www.evergreencpg, that's councilonproblemgambling.org. You will see a number of resources there, everything broken down by training, outreach and awareness events, community events. We are having Tuesday Twitter chats throughout March for Problem Gambling Awareness Month. So you'll be able to find information on how to log into those and participate. And we've had people from all over, not only our country, but from different countries participate in those, and there'll be different topics.
What's
So,
your hashtag?
Hashtag PGAM, PGAM chat.
Okay.
So-
Great. And you mentioned earlier that you're on all kinds of social media to engage youth.
We are.
Okay,
Yeah.
great. And so with just a few minutes left, can you tell me about any more campaigns looking forward beyond March, what you're up to?
Well, one of the challenges we have as a small nonprofit, and why we're so grateful to Thurston Community Media for the PSA that you helped us with, is we have limited budget for the kinds of outreach that we really need to do. We have limited budget for research. You know, nonprofits, we all know, work hard for that, but we are doing a lot of responsible gaming initiatives. We're doing focus groups with gaming industry employees because we have online training for them to be able to learn how to help someone if they are in a gaming venue and remark that they need help or they'd like a number for help. We always have our 24/7 helpline number. If anyone ever needs that, it's 1-800-547-6133. That will get you referral to treatment providers, or you just want information, or your son or daughter is doing a high school paper on this. We'll give them information. We'll give them any help we can. So we have a big conference coming up in May. That's our Focus on the Future conference, and it's going to be at the Great Wolf Lodge just down the road from here. So lots of things coming up in the future, and all year long we are always busy.
And we're continuing to grow and improve our treatment program. We're recently redesigning our gambling treatment program specifically designed for those dealing with co-occurring substance use disorders and all other addictive behaviors. And it's going to, because even those coming to us primarily with a gambling disorder often are also dealing with quitting tobacco, alcohol, compulsive spending, compulsive eating. You know, as she said earlier, these things tend to come together. With a focus on healing from mental health and trauma, etc. And I'm also often trying to get out anywhere I can to help educate about gambling. I'd love to get into different centers, senior centers, help educate the staff on here's signs to look for, here's how you can help, and that kind of thing. So I go into a lot of colleges and things like that.
Okay, well, great. I want to thank you both for coming in and talking to us today.
Thank you for inviting us.
Thank you.
Yeah.
Appreciate it.
That's all we have for you. You can see Mission Nonprofit on Channel 77 on Sundays at 4:30 p.m., Tuesdays at 7 p.m., Thursdays at 7:30 p.m., and Saturdays at 6:30 p.m. You can also catch us online at tcmedia.org. See you next time.